Hi, my name is Ravi Chari, President of the West Florida Division of HCA Healthcare. One of the best things I get to do when I visit the hospitals is spend time with the managers and directors. It's a great time for me to ask them questions, and in turn, they ask me questions. One of the questions I like asking the managers and directors is, who's in charge of the ER? Let me tell you the reason I like asking this question and why it's so important. First, let me start with some of the did you knows about the ERs in the West Florida Division. Did you know that there are 24 ERs in the West Florida Division? 15 are at the hospital sites, 2 are in the second campuses of Largo and Memorial Hospital of Tampa, and we have 7 freestanding ERs. Did you know that in the West Florida Division, last year, we saw nearly 710,000 patients? 13% of those are pediatrics, and 18% of those are self-pay or charity, making HCA West Florida the largest provider of uncompensated care in the West Florida region. Did you know also of those 710,000 patients that come to the emergency room, that 80% are discharged and go home? The 20% that are admitted represent nearly 80% of all of the admissions that come into our hospital in a given year. So really, when you think about it, the ER is the front door of the hospital. Second, I want to talk to you a little bit more about how we serve our patients in the ER. What is it that a patient in the ER expects and deserves? Well, it's fast, efficient, accurate care delivered with compassion and respect. I think all of you know about our wait times and our operational throughput in our ER. Some of you may not know, though, that those wait times started because we wanted to ensure we had the safest environment for patient care. Many years ago in an ER, a patient was harmed by waiting, and we said never again. And so we instituted a process to ensure patients are seen timely and receive accurate care. What you may not know is that we changed the entire industry for the ER. We raised the bar for the entire country on how patients receive care in every ER. Third, our ability to meet patients' expectation is dependent on everyone and every department in the hospital working together. The lab has to get the blood work processed, radiology has to get the films done, transportation has to get patients moved to where they need to be, pharmacy has to deliver the medications at the right time in the right place, EVS to turn over rooms, physicians and nurses have to work together to make the plans of care. In short, all colleagues in the hospital have to work together so patients know we care like family. So, let me ask that question I started with once again. Who's in charge of our ER? Everyone. I want to thank you for all you do every day for HCA Healthcare and the patients we're privileged to serve.